Good day. Today we're talking about the reproductive system. As you can see, it actually has two variations in humans. Um, but when we actually look at it, we can actually look at it from the point of view of two different things. Now, keep in mind, structures are actually going to be very important, and the main reason of purpose of the reproductive system is to produce gon- gametes from gonads. Now, gonads are actually the organs that are the structures that build the gametes, and the gametes are actually the way that we produce specialized reproductive cells. And the specialized reproductive cells are where we actually have half the number of chromosomes that we have in normal cells. So, a lot of it, what we're going to talk about, is how we develop those particular types of cells today. We're also going to look at the structures, and we're also going to look at basics about both systems, male and female. Now, one of the things that you might notice if you do actually have a problem, you're going to actually see that they basically have different areas of expertise. Now, one of the things that you'll notice if you actually have a problem with your urinary tract, you go to a specialist, and it could be a urologist. Men will go to a urologist also for reproductive problems because the reproductive system and the urinary system in men merge together and the products of both go out through the urethra, as opposed to women. Females have two different openings. So basically, they are completely different structures. So that's one of the reasons why you'll notice most women will actually, if they have a problem with the urinary system, they may also go to a gynecologist instead. So I want you to realize that these are the specialties. Now, one of the things that you need to think about is that you have to look at these structures. Now, one of the things that you will notice is that when we actually produce the structures, they are analogous. Gonads from both are developed from the same methodology and the same cell structures as a either an embryo or a fetus. So what happens is through hormonal triggers, it will cause the change to those cells to become either male or female. And this is one of those things that you'll notice as we go along. So when we look at it, gonads could be either testes or ovaries, but they are developed from the same structure, which is one of the reasons in humans it's very difficult to actually have a true hermaphrodite. True hermaphrodites will have both testes and ovaries, or the products of them having both types of gametes, which means both the ova or egg from the female and test, or shall I say, spermatozoa from the male. So I want you to realize now, one of the things that we also have to look at is what are the secondary sex characteristics of each, which is related to the hormonal effects. We also have to look at accessory structures. So I want you to realize that when you're looking at these different structures, whether we're looking at tubes are actually developed by the same type of tissue. The gonads are produced by the same type of tissue for that particular structure. And I want you to realize that we have a variety of things, and we should also look at some of the problems that can exist for both. So, when we're actually looking at the reproductive system, realistically speaking, the main purpose is to produce these gamete cells. Gamete cells are either going to be sperm cells or oocytes, which is the same thing as an egg or ova. You should know those names. Um, when we're actually looking at it, what we actually should also look at is how do we produce those chromosomes. So we're going to talk about that. So one of the things that you might remember is most of the time, normal cells in humans, we have 46 chromosomes. That means 23 pairs. But in gamete cells, we only have 23 chromosomes, period. And basically what we have is half come from your father and half come from your mother, and they join together to produce a zygote or a new individual eventually. So when we're looking at it, This is important to understand the concept of it. Um, we also will notice that gonads will produce hormones, different hormones. The hormones will produce the primary sex characteristics. And you will notice that the gonads for that individual will produce a larger quantity than the adrenal cortex. So we have to consider that that's an important feature. But we also have in the adrenal cortex, we also have hormones produced that will produce the secondary sex characteristics of that gender also. But that is at a much lower quantity, which is one of the reasons why we get both our male and our female characteristics. Now, what is a secondary sex characteristic that's produced by those hormones? If you have testosterone, which is the male hormone, it produces secondary sex characteristics like facial hair. See that? Nice there, right? And we also notice that it also provides aggressive behavior and development of muscle tissue. On the other hand, the female sex hormones, progesterone and estrogen, they produce secondary sex characteristics which will also be things like development of fat tissues in certain areas of the body. As you might notice, most women will actually have development of fat to actually produce milk in their mammary glands. And that is important to actually feed young. One of the things that we're going to actually notice is that it's going to break down each system first. So we're going to see the male reproductive system, we're going to see the female reproductive system, we're going to see how um, the chromosomes play a role. But one of the reasons this is kind of tricky is that we don't really have a full understanding of its purpose unless we also look at development. So we're also going to look at development to some extent. So I want you to realize that these play a role also. So one of the things I want you to also understand is that when we're looking at the chromosomes do play a role. They do play a role as far as characteristics. Remember, whenever we actually have chromosomes, one of the things that happens is we have these chromosomes and they actually imply the production of proteins. And it's the proteins that actually make changes to the characteristics for an individual. So I want you to realize that, and it's very important to understand that these characteristics can be a variety of characteristics, as you already probably know with your own families, that you have characteristics that are similar based on the DNA or the chromosomes. So this is one of those things that you have to understand. Now, one of the first things we're going to talk about is the male reproductive system. When we look at the male reproductive system, you have to think about it. You have the gametes, you have the gonads, you have the ducts, which are basically tubes, and we have accessory structures. So basically, all these play a role. Now, one of the things that we see is we're going to break it down and look at it. Now, if we were to look at this image, what do we actually see? The top diagram is actually the diagram of the male reproductive system. It actually indicates different parts of it. Now, one of the things you might notice is that we have our gonad right in this area. On the lower picture, we have a cadaver, a cadaver's reproductive system. So, what are we looking at? It's right in this area. So, that's where we actually produce the hormones, the testosterone, and we produce the gametes, the sperm cells. So when we're actually looking at it, what happens to it? It then migrates the product, the sperm, to this area, which is basically your epididymis, and then it goes up through the tubes, going up like this and around to the posterior of the bladder, and then joins over here. Now, we're going to look at that. That's actually the ductus vas deferens. And then what happens is once we get into this area, what we see is this is we have our glands right in this area. And once we actually have that, it actually emerges from over here and over here to where it joins to become the urethra. So I want you to understand that this is a rather important concept to understand, and that the merging of our urine right here and our reproductive product goes in through the prostate gland, which is right here. So we will look at those structures. But it's kind of interesting to see what the cadaver looks like so you have a better clarification of what the real images are. Now, one of the things that we will also notice is that, let's see, let's see if I can get this to work right. So you'll notice, look at all those structures right there, okay? And remember, it is to try to help you understand it in comparison to what we actually normally see. So, um, now, one of the things that we also may see is when we go on, we also have the testes are actually found inside the scrotum. The scrotum is basically a skin. That's all it is, basically. And it holds it. But it actually allows the temperature of the testes to be lower than the abdominal cavity. Now, one of the things that we see is typically, just like the ovaries, which are in the female, they're both the same original structure. They both are formed in the same location in the abdominal cavity or pelvic cavity. And what happens is, at some point during the fetal development, just before birth, the testes drop from into the scrotum. And that actually allows for a temperature difference, which is very critical as far as the production of sperm cells. If we don't have that lower temperature, the sperm cells will be produced irregularly. So I want you to realize that. And we also have what's called cremaster muscles, which are actually involved in the spermatic cord that actually allows movement of the testes during arousal. It also causes changes to what may actually occur. So if we were to look at that, here we actually have another image of the scrotum right here. And if we actually were to see the testes are right in here. And what we would actually notice is we also have with the cremaster muscle, it is right around the and here's, let me show you the cremaster muscle right in this area. Okay. So what we actually see in that vicinity underneath it, we have blood vessels, arteries and veins. We also have what I'm going to refer to as ligaments that are involved with the cremaster muscle. And those are critical. Now, here's the thing. If you're actually looking at it, these can actually get damaged. They can also have problems. So there's a lot of concern with that. So I do want you to realize that that is a concern to a lot of individuals. Now, here's the thing. The testes do require blood supply. So it's critical. Um, and one of the things that we also see is that for instance, I'll give you an example. If that gets damaged where there's no blood supply, it can actually have the creation of gangrenous tissue. And so it's rather critical. Um, one of the things that happens, and I'll give you an example. I used to have somebody I used to know, and what happened was they were playing touch football in college, with you know, another team, and well, they re- they eventually became known as Lefty. One of the problems that they had while playing touch football was because they, when you're doing just normal activities, you don't think about having protective gear. And this is one of the reasons that men in general require protective gear during athletic activities. Is that what happened to him was his left testicle got twisted and it actually cut off the blood supply in this area. And basically, what happened is it did cause a considerable amount of pain and discomfort, and he had to go to the emergency room. And luckily, they were able to manually untwist the cord where the cremaster muscle is, and he was then able to have normal functioning. Otherwise, what would have happened is it would have had to been removed if it did not get the blood supply it needed. So, unfortunately, it was on the left side, and so that's why he became known as Lefty. Um, Interesting story. Now, one of the things that you'll also notice, though, is that this is also rather concerning because a lot of times, what we also will notice is that when we actually see things like the this problems here is that a lot of people, a lot of men, don't think about considering the importance of watching and checking. One of the big problems is testicular cancer. And with testicular cancer, it also happens in here. It's similar to breast cancer in the sense that what you have to do is you have to, identify it by touch. And, well, a lot of individuals do not. And a lot of individuals, if they do find something irregular, they don't check because it's such a personal location. They're afraid to ask questions. Well, the problem is a lot of times if there is a lump there, it can actually cause testicular cancer that will actually spread very quickly, and it can actually cause an individual their life. The other thing that I wanted to point out is this cremaster muscle up in this area actually goes through the inguinal canal. Now, the inguinal canal is actually one of the weak spots in men. It actually can have separation of tissue, and that cause what's called a hernia. And hernias are basically separations of tissue. And the separation tissue in this case will also be very critical because it causes pain, discomfort. It may require surgery. Does that mean that it only happens in men? No. Inguinal hernias also happen in women. So when we actually look at it, it does happen to both, but men are more susceptible because of the location of where the cremaster muscle is and the different arteries and veins. So it is rather critical to understand that this is an important area of the male reproductive system. Now, one of the things that we also look at is that the testes are basically oval shaped. They are what's referred to as the gonads. They produce the gametes, which is the sperm cells. They actually have inside tubes. The tubes are known as seminiferous tubules. And one of the things that you may also want to think about, they're like vacuoles. If you remember when we looked at the endocrine system, we had these vacuoles. The vacuole inside actually contains structures, and on in between each vacuole or each tube we actually have cells. Well, in this case, what we actually will notice is the seminiferous tubules are at the location of the production of sperm cells, but in between, what we also have is other cells that create the testosterone. So one of the things that we also will notice is that basically when we actually look at um, this area, we also have a blood barrier. Now, the blood barrier is also very important to prevent any infection, because infections could actually cause damage to the production of the normal spermatozoa. So when we look at the testes, they look like this. Notice at the top is the image, and then on the bottom we actually have real photos of cadaver testicles. Um, Now they are only about 2 inches by 1 inch. They have about ooh, their length is rather. If we were to extend it out, they would be quite long. Okay, so when we're actually looking at a testicle, they will actually stay within the abdominal cavity until about the seventh month of fetal development. Does it ever stay up inside the abdominal cavity? Yes. And this is known as cryptochitism, and that will actually happen sometimes. And if it does, and it doesn't descend soon after birth, sometimes it may happen shortly after, but sometimes it may have to be surgically descended. Um, and if it doesn't, it may also cause failure of the functioning of those testes and may cause the person to be permanently sterile. So they will not produce normal sperm cells. Um, so when we actually look at the testes and they do not descend, this happens in about 3% of full term babies and 30% in premature infants. Um, and surgery can actually help before 18 months. And if the person has it after that time, chances are they're going to be sterile. But they can descend. Um, so when we're looking at the testes, one of the things that we also see is we can actually look at spermatocytes, spermatotids, and spermatozoa. Now, what are they? They're different stages of the production of sperm cells. That's all they are. We also have the Leydig cells. Leydig cells are in between the seminiferous tubules. That's where we produce the testosterone. So, so the spermatogenesis is basically the process where we actually go through the production of sperm cells. Now, one of the things that you'll notice, if you actually recall, a lot of times when we have production of cells, we have to look at stem cells. The stem cells for sperm are known as spermatogonia, and they undergo, normally they will undergo normal mitosis, but some of them will develop meiosis. And if they go undergo meiosis, this is where instead of having diploid cells, which is two pairs of chromosomes, in other words, paired chromosomes, we will actually have haploid, which will be unpaired chromosomes. So you should know the differences between diploid and haploid. Diploid, we actually normally refer to it as 2N, and haploid, we normally refer to it as just N, as indicating the number of pairs of chromosomes. So when we're looking at it, here's a typical seminiferous tubule right here. And you'll notice that if we look at the drawing on the bottom, it actually shows the edge of the seminiferous tubule right up here. And so what we see is we have these cells, the going through the stages of spermatogenesis. They'll go through, the primary spermatocyte to the secondary spermatocyte to the spermatotid until they become spermatozoa. Now, I do want you to realize that this is all a process. It is the different stages of meiosis where this happens. So when we're actually looking at this, basically all when we actually produce sperm cells, one of the things that we see is we have the production going through meiosis 1 and meiosis 2. Meiosis will have a two-cell division process as opposed to mitosis. Mitosis is a one-cell division process. So I just want you to realize that. And it happens at um, in the seminiferous tubules. So when we look at mitosis, which is most cells, what we see is we start off with diploid cells. That means we have 23 chromosomes, 23 pairs of chromosomes, I should say, 46 chromosomes altogether. 23 came from your mother, 23 came from your father. Of those, 22 pairs are known as autosomes, or 22 from your mother and 22 from your father were autosomes. These are chromosomes that only identify everything except gender. And then we have one pair of sex chromosomes, one from your mother, one from your father, and basically it's either going to be an X or a Y. If you are a female, you'll have two X chromosomes. If you're a male, you'll have an X and a Y chromosome, and the Y is just smaller. That's why it's referred to as a Y. And so typically, what happens is when you produce sperm cells, you go through the meiosis process, which actually allows only 23 chromosomes to be passed on. So if you're thinking about it logically, your father really controls whether or not you become a female or a male, whether he actually provides the X chromosome or the Y chromosome. You guys might remember in history, King Henry VIII of England, one of the big problems he had was that he could not produce a daughter initially in his life. And so basically, that caused him a difficult decision because basically, when he actually had children with his wife, he blamed his wife. But in actuality, it was his fault, as far as the chromosomes. One of the things that we see, meiosis in comparison to mitosis, which is important to understand basics about it, it goes through the same phases of mitosis. So what we see is we have prophase, we have metaphase, we have anaphase, and we have telophase. So in but because there's a two cell division process, we actually undergo prophase one, metaphase one, anaphase one, late telophase, and then we go through prophase two, metaphase two, anaphase two, and then uh, telophase, where we actually have the final endpoint. But one of the things that happens right before we actually undergo any kind of cell division process, we actually have duplication or replication of our chromosomes, which means we actually get two sets of these chromosomes. So when we actually do that, it actually creates what we may refer to as a tetrad, where we have, if you're noticing in this image, we have the yellow and the blue, red chromosomes. Let's claim, just to make this easy, and I want you to notice if we're actually looking at this, we could say that the chromosomes, the one red and one yellow, are from two different parents. Okay, so the red is from one parent, the yellow is from the other. So in this case, what we actually see is that, let's say this one and this one are the same. So, but what happened is in replication, we duplicated it. So we have part of it from the original chromosome and part of it which is new. So if we actually were to see this on a normal cell, we would normally have the 23 of each. In this case, we're only showing four, or actually two chromosomes, or four chromosomes, which is two pairs. Um, and so what happens is we actually group them together. So we actually will notice over on this image, we have them paired up and they're lined up like we would see in metaphase. But a lot of times what happens is this, those we call that tetrads. So this is a tetrad, and below it is another tetrad. And because it's visualization, it's hard to show any more than that on a diagram without getting it confusing. So when we're looking at these tetrads, one of the things that happens is a lot of times they get crossover, which means one side can actually cross over the other. And typically what happens is the chromosome at the same loci, which is the same location, may actually switch. So a lot of times you may think about this and say, okay, we've got an individual, and typically we expect, let's say, their hair color and eye color is going to have certain patterns. But then sometimes we actually notice the patterns get mixed up and they're not the same. One of the reasons this can happen and actually increase the typical genetic variation is because we have crossover. So that can actually change the amounts of the um, typical occurrences. One of the things this image shows is this is a larger visual that may give you a better understanding of it. So when we actually look at this middle diagram, this is where we see the crossover. And what happens is we get a genetic recombination. Where in this case, what do we see? We see the little b and the big B, the yellow one and the red one, being switched from the location they really exist on that chromosome. Remember, the large A and large B and the small a and small b are the two chromosomes, but you'll notice that they are duplicated. So basically, we would not see this other set along here under for normal cells. So I want you to understand that. So think about this. If we were to look at it in this reality, as far as how we're looking at the crossover occurring, and how meiosis and mitosis differ, think about this. If you actually were to actually get a pair of shoes, they come in pairs, right? So if you actually bought a pair of shoes and you like them so much, and I know some of you out there, some of you may actually say, I like this pair of shoes so much. They're so comfortable. They fit my feet just right. And so what happens is, and I know some of you may not want to admit it, but there are people that say, I like this so much, I'm going to go out and buy another pair exactly the same. And that's what they do. So think about this as a pair of shoes. So if you're looking at this image and thinking about each shoe, we have a left and a right. Our red one and our yellow one are our left and our right. Okay, so you see that image tied in with this image? And then you buy a second pair, left and right. Now, what do? Normally, under mitosis, you actually have division and you get a left and a right, a red and a yellow from our diagram. Anyway, and so you get them into two boxes, a left and a right in one box, a left and a right in the other box. Okay? So if we divide it up again, then we'd actually get something else. Okay? But that's normal mitosis, our normal cell division. Meiosis is a little different. We get two cell divisions, remember. So what happens is when we undergo meiosis, under meiosis 1, which is the first cell division, it divides, but it doesn't divide the same way we think. In other words, we don't end up at the end of meiosis 1, a left and a right in each box or each cell. What we end up with is both left in one box and both rights in the other box. So with the crossover, it actually gives that variation for each box. And then it undergoes another cell division where we actually get a left, a left, a right, and a right. So we get four boxes, each with one shoe. So when we're actually looking at meiosis 1, that's what we're seeing. Our two lefts in one box or on one cell, and our two rights in the other. So when we're seeing meiosis, it goes through the same stages, like I said, that mitosis does as far as the events. Remember back, you might say prophase, you have, excuse me, the where we actually see the the nucleus disappearing, the spindle fibers, and the spindle, the Spindle fibers are appearing, the ester appearing, the um, and such. Metaphase, they line up on the middle of the chromosome or the equator of the spindle fibers. During anaphase, you have it migrating towards the poles of the cell, and then at during telophase, we actually have cleavage furrowing, which is the splitting of the cells or the cytokinesis of the cells. So those events happen in each meiosis. It's just a matter that now we're actually having changes to what happens to the chromosomes themselves. So when we see meiosis 2, same events happening, but now we're ending up with 4 cells, each with one set of chromosomes, unpaired, haploid, in other words. And this all happens all the time, frequently. Okay. So in the male, which is where we're looking at right now, where do we see it? We see it in the seminiferous tubules. And at the edges of the tubules is where we actually have, at the outside section of the tubule, that's where we actually see the stem cells. And as it undergoes the meiosis 1 and the meiosis 2, it migrates towards the lumen of the tubule, where we actually end up with spermatozoa. And I want you to think about this. When we're looking at this, we actually can see in this image, this picture is a very good image because you can see the sperm cells with their tails right in there by the lumen. But this image also gives us another insight. Over here between the seminiferous tubules is where we have our Leydig cells. Now, think about this hormonally. Hormonally. Follicle stimulating hormone is important because what does it do? It stimulates the production of sperm cells at the seminiferous tubules. On the other hand, luteinizing hormone develops the Leydig cells to produce testosterone. And so when we're looking at how we actually look at the seminiferous tubules, this is another image that shows you that same imagery. Okay? We also see this. This is another image of spermatogenesis. Now, spermatogenesis is the process of meiosis that's happening in the seminiferous tubules. That's all it is. And basically, when we end up with 50% of the sperm cells will be X and 50% will be Y. And all 4 cells at the end of spermatogenesis will actually be viable and functional. So let's look at a sperm cell in general. Here's a sperm cell. What do we see? We have basically a couple parts. We have a head, we have a mid piece, which is right here, and we have a tail. So what are they? And one of the things that we see, we can break it down even more. The head will actually have inside the nucleus the chromosomes. On the outer portion, it has an acrosome, which actually has very effective enzymes that can break through the cell membrane of the oocyte or the egg. The midpiece inside will actually have mitochondria. The mitochondria is useful because the sperm cells require energy, so they have to convert sugars to energy. In the tail will have proteins, and the proteins provide the flagella to actually cause movement. So it requires the energy from the midpiece. And typically we see that approximately 300 million sperm cells are produced per day. And sperm cells only have a 48-hour window of life outside the body. so that it does have a short lifespan. One of the other things you'll notice, growth hormone will play, gonadotropin releasing hormones, excuse me, will also play a role as far as follicle stimulating and luteinizing hormone. So that's important to understand. When we look at it, a lot of times you'll notice that typically we actually have puberty. And puberty is when we actually have the initial production of luteinizing hormone and follicle stimulating hormone, which then causes the production of the testosterone and production of the test the 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 sperm cells. Well, here's one of the things that we also see: that testosterone will cause it's an autocrine type production where we actually have the testosterone producing more testosterone. So it's also very important. So I want you to realize that that's significant. Testosterone will control and actually cause growth and development of the reproductive organs. It also causes a certain amount of bone growth. It also causes the characteristic male secondary sex characteristics, like I said, development of hair on the face, development of muscles, development, which causes a lot of times aggressiveness or aggressive behavior. And so we actually see these happening in many cases. I mean, you guys can see if you actually see somebody that takes anabolic steroids. Anabolic steroids are basically synthetically produced testosterone. But the thing is, we also see this affects your behavior, your way of looking at things. So sexual behavior is actually affected by the testosterone. It also causes deepening of the voice because it causes the muscles and the ligaments of the muscles of the larynx to actually get developed and therefore deepen and make it a more lower tone to the voice. So these are all things that happen during um, basically puberty. But I want you to realize that typically it's the chromosomes that were given to you before you were born that actually develop what your chromosome makeup is. And it is also hormones that are affecting you as a developing embryo that allows at a very specific time during development that allows for you to either turning the cell's metabolism to create the characteristics that make you a male or make you a female. So it's rather important. The control of testosterone is basically a negative feedback mechanism. So here's one of the things that happens. Individuals take anabolic steroids, and we've heard about this, and we've also heard that in the athletics. This has become a problem, and that the Olympics has actually looked at that as a means of identifying problems as far as performance boosters. So, what happens is this: people unfortunately take them, they develop the muscles, but the muscles are not sustained as far as development. But what also happens is it shuts down the production of the luteinizing and the follicle stimulating, which then causes the slowing down of the production at the testes. And so what happens is a lot of times it causes the individual to become sterile. Not only that, the muscle development that happens because of testosterone does not necessarily only affect skeletal muscles. It also affects the heart. So this is one of the reasons that anabolic steroids can actually cause the individual to actually undergo a premature heart attack. So we can skip this inhibin. So we now can look at the tubes or the ducts in the testes. Now, I want you to think about this. We're talking about the ducts or the tubes. I want you to realize that they are also going to be same types of tubes and ducts in the female that develop, but they're called something different. They're known as fallopian tubes. So I want you to realize what we're really looking at so that you're realizing there's a comparison in the female. So when we're looking at it, one of the things that we see, the ducts are beginning at the epididymis. So we have the testes, and then we actually have this reverse question mark type structure known as the epididymis, which is where the sperm cells will be stored, and we'll talk a little bit more about it. And then they go up through the rest of the tubes, which starts off at the ductus vas deferens or ductus deferens. It depends on how you look at it. So we actually can see that. Now, the epididymis is like I call it a question mark, but you could call it a comma shape, but it's on the posterior side of the testes. And if we actually were looking at it, this is where the sperm cells develop, and they're stored for at least a month. And then after that, they're either expelled or broken down and reabsorbed. Um, Now, when we look at it, the epididymis is about 1.5 inches long, um, but it actually is about 20 feet long. So we're talking about also a very long tube. And basically, that's the location where sperm cells learn how to swim. And so they can actually stay there for, in the first 2 weeks, they learn how to swim. And they could be stored there for 2 months unless they're moved up the tubes. The ductus vas deferens, on the other hand, is where the sperm cells will be moving towards the urethra for ejaculation. So when we look at the spermatic cord, this is where it actually migrates through by the cremaster muscle. And so if we looked at the spermatic cord again, here we actually see it right here. Here we see it on the cadaver. Okay. And typically, what we see is it migrates up there until it gets to the ejaculatory ducts. Now, what is ejaculatory ducts? That's when it actually joins the different um, glands. The one main gland that you can actually see is the prostate. When it goes into the prostate, that's what we're really looking at. So, what also joins in is the seminal vesicles. We also have a third gland known as the bulbourethral gland, which is also known as the uh, um, Cowper's gland, and they produce different types of solutions that are added to the sperm cells. Now, here's the thing: what leaves the urethra is not just sperm. Before, it's called sperm. Afterwards, it's called semen. So, what comes out of the male body is semen. So, one of the things that we actually see is it actually joins and becomes part of the urethra, and the urethra will have three parts. We have the prostatic urethra, which is going through the prostate, the membranous urethra, which goes from the prostate at the beginning at the prostate and ending at the basically at the penile structure. And then we have the spongy or cavernous, which is where the penile structure is located. So we actually have those parts. So I want you to realize that. And of course, we have the prosthetic urethra, which is where where we talked about earlier, where it joins from the ejaculatory ducts. So if we were looking at the ejaculatory ducts, notice this. In this image, what are we looking at? Here we actually see Coming up from behind the bladder, we have the ductus vas deferens, and it comes in right over here. Well, when it gets to that point right over here, I'll try to draw this right here. What do we see? We see right over here, and maybe I should have used a different color. So let me try getting a different color that may show up a bit better. Right over here, we have the seminal vesicle. Right over here, what's going through is the prostate gland. And it's hard to see it, but we also have the Cowper's gland right in this vicinity. Now, so when we're looking at as far as structurally, you'll notice that here we actually have a joining, and then right here is where we have our basically where it joins the urethra, and that's the prosthetic urethra. And we have the ejaculatory duct right in this area. So it's not that long. It's very short. It's only 1 inch long. So it does have a difference as far as what you're actually looking at. So I want you to understand that that's one of those things that happens. But it adds fluids. And when we actually look at it, you may notice that the vas deferens, on the other hand, is 18 inches long. And when we look at it from a different view, there's about 8 inches for the urethra. Now, this image is very nice because it actually shows you a transverse, a mid-sagittal cut, so you can actually see a cross section of what's going on. So you can actually see the prosthetic urethra right here, the membranous urethra, and then the spongy urethra, which is basically right along here. Um, so this image is very nice. So I will tell you that that's a very good image to indicate the different structures of the male reproductive system. The other thing that you'll also notice, it's perspective in relationship to the GI tract. So that's rather important to understand. And you can actually see where the bone is located. And if you're looking carefully on this diagram, look at that spot where I have right there. That is the Cowper's gland or bulbourethral gland. So it's very, very tiny. It's just hard to see if you're not looking for it. So I want you to realize that. So one of the things that we see, a lot of times males will actually have vasectomies. Now, what is a vasectomy? Basically, it's a male sterilization method. Years ago, what they used to do is they take the vas deferens, they actually cut it off, they tie it off. It is typically a outpatient surgery, so it can be done in half a day or shorter. Depends on the method that's used. Um, so typically, what they used to do is they just tied it up. Now they actually cut it and tie it off. In reality, one of the things that happens is it doesn't cause any effects as far as hormonally, and it's 100% effective. Years ago, there were some cases where it had some grow back of the tube, which is one of the reasons they cut it and tie it off today. But it's 40% reversible, so it can be reversed in 40% of the cases. So it's not permanent, but it's a decision to make. We also have inguinal hernias. We talked about that. These are very painful. They can be indirect, they can also be direct. They will also affect, you'll find hernias in other parts of the body too. Okay. So it does happen. I used to know somebody that had inguinal hernias on both sides, these weak spots. He was very uncomfortable. He knew he needed surgery, but he was pushing it off until a different time. I also knew I came across a patient who was a woman in her late 80s. She was taking care of her elderly husband, who was older than her, and she was lifting him. And she came in to the hospital and had a double hernia situation. In other words, both sides. And unfortunately, this was not her first time. This was the second surgery for this. So it does happen, and sometimes it does reoccur. Depends on what the person has been doing activity wise. And, well, it can actually cut off other structures like blood vessels and nerves. That's why it causes pain and discomfort. Accessory sex structures of males. Well, these are very interesting because we have our glands. The glands are basically the accessory sex structures. One of them is our Cowper's gland, our bulbourethral gland, and our seminal vesicles. So the seminal vesicles, in particular, will actually be more alkaline. They will create fructose, prostaglandins, and some clotting proteins. Do I want you to know all that detail? No. I do want you to know seminal vesicles, and you should have some understanding of it. Okay. So the seminal vesicles are basically right here. The prostate is here, and the Cowper's gland is right there, like we talked about earlier. In another image, this may actually also give you insight. Seminal vesicles, prostate, and then the Cowper's gland is way down over here. So it's very tiny. Um, so this is important because remember, if we actually have an ejaculatory event, basically what will happen is the male will actually need, or his sperm will need energy, so that it will need the sugar, the fructose, to actually allow for the movement. So one of the things that we see is another thing that we actually see is the prostate. Now the prostate is about it's not that big. It's donut shaped, about the size of a golf ball. It does create acidic, like citric acid in there, and it will have enzymes like PSA, which is known as prostate specific antigen. This is rather important because prosthetic specific antigen is a tracking device for most males as far as if it's produced in high or low amounts. This is one of the things that we can look at. And a lot of men, as they get older, they will have prostatitis, which is basically an inflammation. And that inflammation will actually cause, and I want you to think about this. Here we actually have this donut structure. Let's see if I can show you. You have this donut structure, and typically what happens is if it gets inflamed and gets more of a inflammation, it then narrows the opening. And what do we actually see is that's where the urethra goes through. So if it actually cuts it off, it actually causes the individual to have an inability to urinate. And so what happens is it causes pain, discomfort, pressure, uh, and it may also be asymptomatic. And this happens more as a man, a lot of times, older men over the age of, let's say, 45, they have a more susceptibility to this. Men over the age of 50, the PSA may actually increase, but the levels may differ. And a lot of times, PSA may actually go up if there is a problem, such as prostatitis or even prostate cancer. So we can see this as a tracking method by looking at the antigen. So when we're looking at it, you can also say that it actually causes, it's about the size of a chestnut if you're looking at trying to get a view also. But it has enzymes that will liquefy uh, other substances. And that's important when we're actually looking at the semen. The bulbourethral or Cowper's gland will actually create more mucus and it neutralizes acids. And they're pea shaped, they're not that big. Now, semen has a mixture of all of the fluids. And those fluids are important because one of the things that happens is if an ejaculation occurs, it to have the transport of those sperm cells, they have to have the enzymes and the proteins and the ability to liquefy the structures and to actually um, cause neutralization so that they can actually get the sperm cells to the location that they're traveling towards. Um, but it takes, um, they can coagulate in 5 minutes, and after about 10 to 20 minutes, it becomes liquefied again. And a lot of times they create a tube, and that tube will allow the sperm in the middle of the tube to move through like basically um, a pipe that they formed. So that's one of the things that we see. And basically, what we see is about 2.5 to 5 milliliters in a typical ejaculation, and that will contain about 50 to 150 million cells, sperm cells, in 1 milliliter. So if you're looking at it, at the minimum, we're looking at about 150 cells. And basically, this we were looking at those numbers. If we're looking at the low numbers, if it's a low count, if we have cells that have two heads, two tails, the tail is put on backwards, or whatever happens, that will actually cause abnormalities when we do analysis of the semen. And a lot of times that can actually affect also the ability, if a or if a couple is trying to have a pregnancy. So this is one of those things that they look at to see what is the viability of the sperm cells by looking at the fertility analysis of it. The penis, on the other hand, is basically it's a structure that has sinuses for blood. You'll notice that along it, it actually has um, the spongy urethra. It does actually have these sinuses around it, and essentially, it has muscles that will actually shut down the blood flow and actually cause the blood to actually pool in it and expand during stimulation. Um, One of the things that you also may notice is that there is the root, the body, and the glans penis. Now, the glans penis is the end of it. That's where we actually will have a high concentration of receptors, nerve receptors, to actually get stimulated. The body has mostly the sinuses, but the root can also have a certain amount of attachments, which include the the ligaments to the pelvic cavity. Now, if we actually were to look at it, here's a structure of it. Now, notice we actually have the root here, and here we actually have the body. Okay, and here's the glans penis. Now, one of the things that we also may notice is this, um, that here's the cross section to give a better insight of where the urethra is and how the spongy tissue is. Now, a lot of times you may actually hear people say, "Oh, it's a muscle." Well, it's not. The muscle is actually where we actually have the controlling of the blood flow. That's it. And when we actually look at it, this is an image that gives you better insight as far as the views, but it won't expect you to know all of this. Um, Also, if we actually look at this diagram also gives you a little bit more insight. Now, notice the glans penis does actually have the prepuce, or what's also known as the foreskin. This actually is found if in a lot of males, but a lot of times it becomes circumcised, which means removal of a portion of this foreskin. So, a lot of times in the past, it's been done because of religious reasons. It's also been done because the belief that it does actually can cause a more hygienic type environment. The one thing that I've also heard, and this is one of the reasons why I'm going to talk about this a little bit, um, that also there have been people that have in recent years they've actually have a reversal of the circumcision, so which means that they actually have a piece of skin actually reattached to actually have that plastic surgery to actually put there. Now, why do they do that? A lot of times it's because they're trying to a lot of times when it's removed, it removes some sensitivities. Now, the other thing that you'll also notice, one of the other things that you see, there's other plastic surgeries done today, which is kind of unusual. There have been people that have, men in particular, they get some issues with size. A lot of times, length has been affected, and so what happened is one of the big things, or girth, which is the width of it. So a lot of times, what they will do is they will weaken these connections, and then it actually is able to protrude further out. But it also makes it more likely that it can actually rip and tear and have more damage later on. The other thing that they do is sometimes males worry about the girth and because of their own fears psychologically. And what happens is they can do plastic surgery to widen that, but that's also uh, has concerns mainly related to their own psychological view of themselves. So that's why it's considered a plastic surgery type occurrence. So that's the male. I want you to think about that a second and realize that the male reproductive system has a lot going for it. Now, one of the things that you'll notice, and I want you to understand, it may seem like the male is more complicated because there's a lot more structures than the female, and that may be true. But the female reproductive system has more physiological aspects to it that take more understanding of what's going on. So I want you to realize that when we're examining it, it does actually play a significance. So just so you get a comparison right now, you're going to actually notice that this is the male and how it looks at the in the pelvic area. And so when we're looking at erections and ejaculation, it is all parasympathetic when you're relaxed. It's not a sympathetic occurrence. And the ejaculation is where we have sympathetic reflexes actually stimulated. So when we're looking at it, it's to trap the blood in the spongy tissue or the spongy urethra area of the penile structure, and then trapping it causes it to become more pronounced because of the blood pressure inside, and it then causes the rhythmic muscular contractions to allow the semen to actually, the sperm and then the semen to actually be projected out. So the female, on the other hand, like I said, as the male, you have the gonads, which produce the gametes. It also produces the hormones. You have the tubes, which in this case will be the fallopian tube, which is also known as the uterine tube, which is also known as the um, goes by one more name, uh, oviducts. Okay, so those are the three names. You should know those three names. You have the uterus, which is also known as the womb, WOMB. You have which ends at the cervix, which is a narrowing of the uterus, which then allows it to connect to the vagina, which is a muscular structure. And then we get the vulva, which is also skin flaps, synonymous with the scrotum. So you have that connection. And then, in addition to that, the female reproductive system also has the mammary glands as part of it because they produce the milk for the infant if there is a fertilization process. So I want you to realize that. So when we're looking at the female reproductive system and look at that diagram gives a good comparison to the male diagram of the same mid-sagittal cut. So you have a better understanding. And one thing that this does is this diagram actually gives you the indication of where structures are. So here we have our urethra, here we have our vagina, and here we have our anal canal with our rectum. So it gives you a perspective of location of structures. So that's important to understand. So if we were to look at a real cadaver, this is a cadaver. Notice it looks the same as the diagram. We still have the urethra right here. We have the vagina right here. And we have the anal canal right here. So all structures, and this is one of the reasons why you may actually look at this and say, "Oh, I can see it goes from anterior to posterior as far as the structures." So that's kind of useful to understand. Now, let's take a look at what else happens. No, so if we look at the ovaries, they're going to be paired just like the testes are. They do develop. One of the big differences, both are formed during very early stages of fetal development, during the embryo or embryological development, I should say, and developing later on into fetal development. They will be held in place by ligaments. A lot of times they may look like this. Now, you're looking at this and saying, what? This is what I'm looking at? How's that possible? The same structure? Well, if you actually look right here and right here, those are our ovaries. And you'll notice they connect to the fallopian tube, which is right here, and goes right over here to where we have the uterus. I'll draw the other side so you see it. Okay? So that's where we see it. Now, I want you to understand that those structures are rather important to see there. But when we actually look at them, one of the things that we see is they develop follicles. Now, here's the thing the follicles are going to be whatever number of follicles you develop, as by the time you're born, is the amount of follicles you'll have for the rest of your life. You don't form any others. So when they're gone, they're gone. So one of the things that we see is they develop into different follicles: primary follicle, secondary follicle, and then Graafian follicle. And this Graafian follicle is where it expels the secondary oocyte through the process of ovulation. And what happens is once the oocyte is expelled into the abdominal cavity, which is important to realize, hopefully it migrates over to the fallopian tubes. And what happens is that follicle that existed there then causes the production of what's called the corpus luteum that then develops and produces progesterone and the estrogen hormones. And it will eventually degrade and become white. So that's why it may be referred to as eventually as a corpus albicans. And the corpus albicans, one of the things that happens is sometimes that develops hardened structures, which may become some sort of a uh, hard scar tissue. I'll call it that for the moment. Okay? So sometimes it becomes more of a problem, and sometimes it doesn't. Hopefully, it doesn't. So when we actually look at this image, you're actually looking at an ovary. Now, one of the things about this image that's very useful for your understanding is up at the top, we have those primordial follicles that develop into a primary follicle, which develops into a secondary follicle, and then into the Graafian follicle, which then causes the production of the corpus luteum, which is over here also. And we have the oocyte, the secondary oocyte. And then what happens is that corpus luteum can actually go to become a corpus albicans. So that's the stages of how it progresses. Um, so when we look at oogenesis, which is the formation of the female gamete, the egg, um, it goes through meiosis 1 and then meiosis 2. Big difference though. When we looked at the male, we produce 4 sperm cells during spermatogenesis. So it's important to understand the similarities and the differences between oogenesis and spermatogenesis. So in oogenesis, what happens is you have these developments: primordial, primary, secondary, Graafian, which is a mature follicle, corpus luteum, and then corpus albicans. But what happens is the meiosis 1 occurs during this progression into a Graafian follicle, and then meiosis 2, fertilization is actually required. So when we're looking at these stages, we have these occurring. And so what happens is like we said before, sometimes we have this corpus albicans becoming white scar tissue, and it can degrade. But when it doesn't, a lot of times it may actually create a fluid filled sac, which is then a cyst. And most don't require anything, but if they become large and if they become painful and they become more of a problem, then it becomes where they may need surgery. So, graphene follicles will have different parts. I don't want you to worry about those parts. But when we look at the development of the oocyte or oogonia, basically what happens is um, a female will actually produce millions of them during mitosis, but degrade some. So by the time a person is born, they only have between 200,000 and 2 million follicles. And by the time they reach puberty, they may only end up with about 40,000. That's a considerable drop. And they may only have 400 that mature during reproductive life. And of course, once they hit menopause, they stop developing the follicles, typically. And so this is important to realize that not all of them will actually get developed. So when we're looking at oogenesis, which is the development of the oocyte, um, you'll notice we have meiosis one right down to the secondary oocyte. And what happens is, one of the things that happens during this, that we have the splitting of the cell, but we end up with a secondary oocyte and a polar body. Polar bodies are basically there, and they will actually split. And if we actually have, and they'll be there for protection and energy for the cell if it does get fertilized. And so what happens is when we have the secondary oocyte and it becomes fertilized and become an ovum, basically it will undergo meiosis too, and that's where we see another secondary polar body. So you end up with one, two, three polar bodies and the ovum. And the ovum, once the egg is fertilized with the sperm cell, it will now have from a haploid to a diploid number. It will then become a zygote, and that zygote will then undergo normal mitosis to develop into different stages of the development of that new individual. So, when we're looking at it from the point of view of what's going on, here's another way of examining the oocyte. And so, notice on the left, we actually have the development during for what happens. So we get one, two, three polar bodies, and we get the ovum, and that becomes the new individual. And otherwise, this is what happens if no fertilization does not happen, and that's what happens with the follicle. So this is happening with the follicle. This is what happens with the oocyte. Do I need you to know all those details? No, but I just want you to visually at least identify them. So what happens? Well, we need to know what happens after the oocyte forms. So one of the things that happens is, and I want you to notice this diagram. We have this ovary. If we actually have the release of that oocyte, it's going to be released out here in the abdominal cavity. Hopefully, it goes into the fallopian tube, which is over here. So what happens is the end of the fallopian tube will have what's known as finger-like structures, known as fimbriae, and the fimbriae will actually have cilia, which actually may pick up the oocyte and they can then migrate into the fallopian tube until it gets to the uterus. The uterine tube or the fallopian tube will actually have cilia, and that will actually help to move the secondary oocyte into towards the uterus. And it's usually in the upper regions of the fallopian tube is where fertilization actually occurs. Um, so, do I want you to worry about all the layers? No. But what I want you to realize is that the fimbriae are important as far as sweeping the oocyte into the tube, and that the cilia and also peristalsis plays a role as migrating the oocyte towards the uterus. And basically, fertilization has to occur within 24 hours after fertilization or after ovulation. Otherwise, it becomes very iffy if it will get fertilized. So it's a very tight window of opportunity if a person and their partner are trying to have a child. And it will take 7 days for that zygote to actually reach the uterus. So it's not a long distance, but it does take time. So if we were to look at the uterine tube, this is what it looks like inside. Notice the cilia. Also, when we look at the uterus, which is also known as the womb, excuse me, it's shaped like a pear in upside down. And basically, it has a lot of things that can happen in it, but there are sections of it. There's the fundus, the cervix. The cervix is narrowing to allow for the opening to the vagina. So basically, it's about 3 inches by 2 inches, and We have the fundus, the right up here, the body, the cervix, and the isthmus. Okay, so basically the parts. Um, Basically, one of the things about the uterus is a lot of times we actually have um, we can actually have prolapsing of it. One of the reasons, one of the things that we've noticed is that when we look at the uterus, it actually has a positioning either above the bladder or at a different angle. So it is normally anti-flexed, but it can be retroflexed, which means it can actually have a different angle. And a lot of times that position of angle can actually affect as far as different ways that it functions normally and abnormally. Also, we can actually have it where it actually prolapses, which means it loses its ligament structures that hold it in place, and it can actually get dropping, dropping through, out of its opening of the vagina. So what we actually see is we have mild, which is first degree, where it's pain, discomfort. Second degree, where it's more noticeable, and third degree where it's a complete where you can actually have it actually unfortunately hanging outside of the body, and this is painful. I want you to realize this is a very painful occurrence for the woman, and very embarrassing, and very confusing because they see this thing that's it's hanging out and they don't know what's going on. A lot of times this happens because the ligaments are not holding in place because of a variety of reasons. Um, and if it becomes a third degree or a complete prolapse, what happens then is the individual would need surgery for correction of it. And a lot of times it becomes the surgery will be a hysterectomy. So if we were looking at the cadaver again, here we actually have the uterus right here, and notice it's actually superior to the bladder, and also um, one of the things that you'll notice, this is anti-flexion. The angle is rather important to understand, and if it's more tilted towards the uterus, okay, so it's more up like, that would be more retroflexed. And that may actually change whether or not it's able to have a greater or lesser chance of having fertilization. We also notice that on the structures, we actually have different layers. Now, this is where it's important to realize that on the middle layer is a myometrium, which is muscle. There's three layers of muscle there. And then the innermost layer, the endometrium, basically is more of epithelial tissue, which has two layers of it, which has the stratum functionalis and the stratum basalis. Strong, the stratum basalis is next to the myometrium, and it actually grows and actually develops the stratum functionalis, which is the portion that actually sheds monthly during menstruation. So if we were to look at it in a picture, in this image we have the myometrium, which is the muscle layer, and then we have the stratum functionalis, which is what's the base layer that actually develops the endometrial layer, and then we have the stratum functionalis, which is the portion that actually increases and becomes spongy and sloughs off monthly. This is one of the reasons. This is one of the things that happens is it also develops a blood supply, which makes it more soft and actually has a lot of cushioning portions, which is why it's important during if there is a fertilization event that it can embed inside this layer. Um, but if we actually look at when we actually look at menstruation, It has bleeding or blood in it because when this sloughs off, it also loses blood supply that's actually going through this layer. So it does play a significance. Um, and so the blood supply can actually be very um, noticeable. Um, and there are individuals that have problems with the development of this. You have myometriosis and you have endometriosis. A lot of endometriosis does occur often enough where you actually have different connective tissue where it becomes hardened and structures that make cysts and basically causes discomfort more so than normal. And so that may require surgical intervention. But if we actually look at myometriosis, which is actually damage to the muscle layers of it, that's even more severe and more painful. And a lot of times, what happens is a hysterectomy. A hysterectomy may be required, where it requires the cervix removed, or also the possibility of an ovarial hysterectomy, where we actually have removal of the ovaries and the uterus. But a lot of times, if they don't want to remove um, the ovaries as much because a lot of times the ovaries can still cause the production of the hormones, which keeps normalcy of the reproductive system and the hormones, and so it lessens problems for that individual. A lot of times they may actually notice that there's a need for also um, hormonal therapy for that individual. So it plays a significance. Um, but when we look at it, you do actually have a lot of fluids involved, mucus plugs and things like that in the cervix under normal circumstances. So a lot of times we have that. Normally you'll see cervical plugs or mucus plugs in the cervix to prevent fertilization to occur. Um, so it's rather important to understand, and it becomes weak when there has been time where the individual is then undergoing the possibility of fertilization. So one of the things that we